All right. Hello, everyone. Thank you so much for joining us today. All right. I see a couple of people coming in. My name is Karen Herrera, and I'm the Parent Center Advocate. And presenting alongside me today is Betty. Betty, if you want to introduce yourself.
Thanks, Karen. Hi, everyone. My name is Betty Baez-Mello. I'm the Director of Early Childhood Education here at Advocates for Children of New York. Thank you so much for joining us. We will get started in a few moments. We're just trying to allow time for more participants to join.
Right. So I'm going to launch a poll just to let us know who is joining us, parents, professionals, and where you are. Okay, I'm seeing a lot of parents. That's great. All right. Well, really, thank you all so much for joining us. Today, we're going to be going over the kindergarten IEP and all right, yeah, seeing a lot of parents. Okay. Okay. A lot of them from Brooklyn. Wonderful. And then we'll just wait another minute and then we'll dive into the presentation.
While we wait, just a quick note for some of the questions we get most often. We will be sharing copies of these slides with you after the presentation. So if you register through Eventbrite, you'll be receiving an email later today or tomorrow with resources, including these slides. We are recording today's session, so you'll also receive a link where you can watch the video. We're going to cover a lot of information, and sometimes it's just helpful to revisit it. And with that, I'll send it back to Karen.
Thank you so much, Betty. All right, so I think we've gotten a good handful of responses, so I'm going to end the poll and let's get right into it. All right, like I said, today we're going to be going over the kindergarten IEP process. So Betty, if you can go to the next slide. All right, so all children born in 2020 have the right to a public school kindergarten seat in September 2025. Two processes for families of children with disabilities is the kindergarten IEP process, which is what we'll discuss today, and the kindergarten admissions process. So families of preschool students with disabilities will participate in a kindergarten IEP meeting this year to determine the special education services that your child will receive next year. The kindergarten admissions process is for all families, including the families of students with disabilities. They are encouraged to apply to kindergarten. The application to apply to DOE schools will be available this winter. Because public schools serve children with and without disabilities, most children will attend the school that makes them an offer through the kindergarten admissions process. And again, we'll cover this topic in a separate webinar, which you can register for on our website. All right, so for today's training, I will be giving you all a brief introduction into, who AVC is, what the work that we do, the legal rights, preparing for the IEP meeting, understanding the IEP, programs and services, communication, applying to kindergarten, and resources. And again, we'll be going over a lot of information, but don't worry, like Betty previously said, we'll be sending you a copy of these slides and a link to our guides that have all this information so you can read about it and refresh your memory later on. Also, if you have any questions, feel free to enter them in the Q&A, and we'll be taking pauses throughout the presentation to answer them. All right, so what is Advocates for Children? AFC is an independent agency that protects the rights of all New York City students. We offer a variety of services, our helpline being the most popular. Our free helpline is open Monday through Thursday from 10 to 4. If you have any questions or concerns relating to your child's education, you can, feel free to give us a call. We also offer free legal services to low-income families, as well as guides and resources available on our website, and offer workshops and trainings just like this one. We also do policy advocacy and impact litigation work. All right, so the law for students with disabilities is the Individuals with Disabilities Education Act, the IDEA, and this is a national law protecting the educational rights of all students with disabilities. All right, so the Individuals with Disabilities Education Act states that all children through the age 21 with a disability have the right to a free, appropriate public education, we'll refer to it as FAPE, in the least restrictive environment, we'll refer to it as LRE. FAPE pretty much means just like their peers, they can attend, oh, just like their peers who can attend free public schools, children with disabilities also have the right to a free education that is appropriate to meet their unique needs. Appropriate meaning an education that will allow a child to make meaningful progress. And then in the least restrictive environment, pretty much means we want children with IEPs to learn alongside students without IEPs. However, the least restrictive environment depends on the student. So some students with disabilities can attend a general education classroom with added supports like speech therapy or physical therapy, and others may need a small special class with a special education teacher. All right, so an appropriate education means one that allows a student to, and I'm going to launch it. Yeah, great. Oh, hold on. Where is it? Oh, all right. So an appropriate education means one that allows a student to A, reach their full potential, B, make meaningful progress, C, make at least some progress, or D, attend their local school. Okay. All right. So the answer is um, the answer is B, make meaningful progress. And so this statement sometimes sparks, some disagreements because, everyone's definition of appropriate may be different. And so we want you all to understand that an appropriate education means one that allows a student to make meaningful progress. All right, Betty, next slide. Okay, so what is an individualized education program? So what is an IEP? Individualized meaning that each program, each IEP is different for each student. It's created at an IEP meeting by the parent and professionals such as, teachers, counselors, etc. It's legally binding, so everything on the IEP must be provided, and it's valid for 1 year, so it has to be reviewed annually. If your child is eligible for services, the DOE will create an IEP. It's like your child's preschool IEP. The kindergarten IEP is based on what the student needs, not what the school has. Each student should look different. And again, must be reviewed at least once a year, but you can always request to have an IEP meeting. All right, so preparing for the IEP meeting. This year, your child will have another preschool IEP meeting. Separately, each child will have a kindergarten IEP meeting to discuss whether your child needs an IEP for kindergarten, and if so, what type of class and services your child needs for kindergarten starting in September. So the Department of Education's role, the DOE sent you a mailing with information and a list of kindergarten orientation meetings in the fall. If you did not get this mailing, work with the preschool staff to make sure the Committee on Preschool Special Education has your correct address so you don't miss future mailing. In December and January, the DOE will host online We'll host kindergarten orientation meetings for families of students with disabilities. We'll share the dates later in this presentation. The Department of Education will send you a notice of referral. Many families will receive this letter starting in January. Each child's transition is assigned to a Department of Education representative, usually a psychologist or social worker, working at a school or at the Committee on Special Education regional office. Most commonly, the representative is the psychologist at your zone school. The notice of referral will inform you which school or CSC office will be responsible for working with you to develop your child's kindergarten IEP. It will also include what evaluations the DOE expects to conduct. The DOE representative assigned will review your child's preschool IEP and progress reports and decide whether or not to do classroom observations and any other assessments. You will receive a notice of whether or not new assessments are needed. The DOE conducts any new classroom observations or assessments, and they should be conducted in person. The DOE is also responsible for scheduling IEP meetings between February and May. Now for the preschool's role. So the preschool is responsible for preparing progress reports and submitting it to the Department of Education. They're also there to assist families, recommend parents and preschool teachers discuss what they think would be a good fit for kindergarten, and attend the IEP meeting. And as for your role is to learn all that you can about this process, and you're taking a great step by being here today. You can check the My Schools directory, or contact schools to schedule tours, ask about different type of classes, speak with current teachers and providers, also review progress reports, evaluations to help assess what type of class and services would be appropriate for your child for kindergarten. And again, not all children need new evaluations before the IEP meeting. That being said, though, you can request evaluations if needed or wanted from the DOE by writing a letter to the Department of Education representative in charge of your child's transition, or obtain private evaluations, again, if needed or wanted. Keep in mind that some evaluations or assessments may be done remotely. The DOE representative may join your child in the Google Classroom, or if that's how it's done. If your child has medical needs or will need special transportation accommodations, you can get a medical form completed by the doctor, and they're also available on the DOE's website. And if you can't find it, your preschool can help get you a copy. All right, so now we're going to stop for any questions. Do we have any questions right now, Betty?
There are no questions in the Q&A. So families, if you have, or participants, if you have any questions, please start entering them into the Q&A. We're going to pause periodically throughout the presentation to answer them. I'm going to take over presenting, so Karen will also be able to answer questions right through the Q&A as well during the rest of the presentation. So thank you, Karen. Okay. So now we're going to go over the IEP meeting itself and who attends the IEP meeting. If you're here today, it's most likely because you're the parent of a preschool student with an IEP, which means you've attended IEP meetings before. And so I just want to share that you're probably much more familiar with this process than you think. Although there are some differences in kindergarten than in preschool, want to reassure you that you can do this, you know how to advocate, and you should feel comfortable in any IEP meeting that you attend. So who are the key people who will be at the IEP meeting? Primarily you, the parent. You're required to attend. The DOE needs to do everything possible to ensure that you can attend, which means that they have to give you notice before the IEP meeting, at least 5 days notice, so that they can make sure it's at a time and a place that's convenient for you. And if it's not, you have the full right to request that they reschedule the meeting to make sure that you can attend. Some other key people: a special education teacher. If your child currently has a preschool special education teacher, that should be the teacher who's at the IEP meeting. So that could be a SEIT if your child is receiving special education itinerant services, or if they're attending a preschool special class or an integrated class, the teacher from that classroom. There should be a general education teacher. If your child is attending a general education pre-K program, that teacher should be present. If not, but the DOE believes your child may be considered for a general education classroom for next year for kindergarten, then the DOE should secure a general education teacher to attend the meeting. Some other key people include school psychologists. This is a person who can explain the evaluations, can explain the different program options that are available for kindergarten and how they're different from preschool. A district representative who knows all of the district services that they can provide. This doesn't mean that the DOE should be making recommendations based on what they have available, just that there should be somebody at the meeting who can explain to you what is generally available and offered by the DOE. Sometimes, by the way, the district representative and the school psychologist, all of these roles can be held by multiple people or the same people. So the district representative may also be the school psychologist. They may be a general education teacher. There are other people who may also participate in the meeting, but aren't necessarily required. That includes interpreter. If you need the meeting to be done in a language that's other than English, you should request an interpreter before the IEP meeting by contacting the DOE representative who's assigned to your case. There can be a parent member who is someone who would be there to help you advocate. It's another parent who has been through the process and is there to assist and support you throughout the IEP meeting. If you would like a parent member there, you need to make that request also before the IEP meeting to the Department of Education. The DOE can provide a DOE doctor at the meeting if there are medical forms or complicated medical needs that your child has. This is also something that you should request in advance. And then if there are people that you would like to invite, for example, another caregiver that works very closely or takes care of your child throughout the day, that person can participate. You should just make that request to the DOE beforehand. If you want your child's own doctor or somebody who's done an evaluation of your child to be present, you can make that request to the Department of Education as well. Anyone who's familiar with your child that you request participate, who can share insight at the IEP meeting, you should make that request to the DOE. They should be allowed to attend the meeting as well. These meetings should be back in person, but I put this phone logo here because they have been taking place by phone over the last few years since the pandemic. But if you request that the meeting be in person, if that's your preference, the DOE should do everything possible to have that meeting in person again. And whether it's in person or by phone, everyone is still required, these key people are still required to attend the meeting. Everyone should introduce themselves so that you know who's on the phone. And so just checking in to see that you're still with us and to see if everything's kind of sinking in. Who is not a required member of the IEP team? A, the parent, B, the child's special education teacher, C, the child's pediatrician, or D, the DOE district representative. I can't see the results, so Karen, I'm gonna need you to let me know.
So right now, the answer, or I should say the choice people are choosing most is the child's pediatrician, so C.
Great, and that is correct. The child's pediatrician is not a required member. It's not a required participant at the IEP meeting. That said, if you, the parent, would like your child's pediatrician to participate, and we see this sometimes when children have complex medical needs that will require additional accommodations in kindergarten, or if the child may require home instruction or something similar, a family may want their child's pediatrician or an evaluator to be at that meeting. So you can make the request, but they are not a required member of the IEP team. Okay. All right. One main area of difference from preschool to kindergarten is a child's classification of disability. In preschool, all students are classified as preschooler with a disability, but for kindergarten, each student receives one of these 13 classifications. These classifications are how eligibility is determined. If the child meets one of these classifications, then they're eligible for an IEP. That said, the classification does not determine what services a child will receive. And so of these 13 possible classifications, the DOE will choose, for example, autism, deafness, deaf blindness, emotional disability. It doesn't mean that a child can only receive speech therapy if their IEP classification is speech and language impairment, right? A child with any of these classifications who needs speech therapy will be able to receive that service. Something to note with these classifications that comes up fairly often, children, for example, who are diagnosed with ADHD often receive the classification of other health impairment. And for children with autism, if they have a diagnosis of autism, that's most likely going to be the classification, even if they may also meet other classifications like speech and language impairment or emotional disability. Because with autism, it's kind of one exception where children with that classification do have the right to an additional service, or really their parents have a right to an additional service, which is parent training and counseling on how to support their child with autism. And so we do generally see that if a child is diagnosed with autism, that's most commonly the classification that will be recommended on their IEP. Okay. And then the IEP itself, or other sections of the IEP. And again, as parents of preschoolers with IEPs, you should be familiar with the form and all of the paperwork. At the meeting, when you're creating the IEP, one of the first sections that you start with are the present levels of performance. And what this includes is the results from evaluations that have been done of your child. It includes the results of the progress reports that your child's preschool team have prepared, and letting the DOE know how your child's strengths, their needs, the areas where they're making progress, the areas where they need more support. All of that goes into the present levels of performance, and all of that should be discussed at the IEP meeting, again, with you there. And that's also why it's so important to have your child's teacher also be present at that meeting, because besides you, the person who's most likely most familiar with your child at that meeting, and they have a lot to share about how your child performs in the classroom specifically. The IEP also includes annual goals. These should be discussed at the IEP meeting. Annual goals should be what we call specific and measurable, right? So they are the goals that your child should be able to receive with appropriate supports over the next year. So you'll be thinking about, at the end of kindergarten, what will my child be able to accomplish? They should be specific to your child. And when we say, measurable, for example, one goal that would not be a good goal is by the end of kindergarten, Karen will be a better reader. That doesn't tell us where Karen is now. That doesn't tell us how we're going to be able to measure if she's making progress. It doesn't really give us anything specific. A better goal would be in the next year, Karen will be able to read 5, 3-letter sight words or something similar, right? It's something that we will be able to do a quick check, or you'll be able to do a quick check at home to see, like, okay, well, by January, she's reading 3 of these sight words. And then, if she's making progress towards that goal, and I know she'll be able to reach it. The IEP should include the recommended program. This, generally speaking, is the type of classroom your child will attend next year. We're going to go over the different program options that exist for kindergarten in just a moment. It should include the related services and supports that your child will receive and how often they will receive those supports. A lot of these related services are the same that are available for preschool, but we'll quickly go over them later in this presentation as well. And there are sections throughout the IEP for parent concerns. You should be an active member of the IEP team and raise any concerns you have. There are actual sections in the IEP that are reserved for the DOE to write in any concerns you have, or anything that you want noted that your child's doing particularly well, or areas where you disagree with evaluations or what other participants are saying. So please feel free to voice all of those concerns. And as I said, we're gonna go over the different program options that exist for kindergarten. we're going to go through least restrictive to most restrictive. As Karen said at the beginning of the presentation, to the extent possible, we want students with disabilities to learn alongside students without disabilities or students without IEPs. And it's been proven that that's better for all students and really improves their ability to learn. So we're going to start with least restrictive and go to more restrictive. All the programs we're going over on this slide specifically are programs that are available in DOE District 1 through 32 non-specialized schools. That's like a mouthful, but those are basically your zone schools, your community schools. Most of the neighborhood schools in your area would be considered DOE non-specialized schools. These are also the schools that you can apply to through the DOE kindergarten application process. That starts on December 10th. Okay. So least restrictive is general education with supports and services. A general education classroom for kindergarten is generally a classroom of about 25 students, potentially more. There's one teacher who's a general education teacher. Your child can attend this program if they have an IEP. They may receive services, push in or pull out, where they're working with a professional for parts of the day on some specific skills or areas of deficit. A little bit more restrictive is an integrated co-teaching class. This is a classroom that serves children with and without IEPs, where they're learning alongside each other throughout the day, but the students with IEPs also have the support of a special education teacher who's there to modify lessons or work and kind of more individualize any type of curriculum for them. These are also classes of about 25 or more students, so it's still a larger classroom setting and within this classroom, children can continue or students can continue to receive any of the related services that they need. Then more restrictive, but still within these non-specialized schools, are special classes, also called self-contained classes. And the most common ratios are 12-1-1 or also 12-1. That ratio stands for 12 students, 1 teacher, and in the 12-1-1, there's also a teaching assistant in that classroom. All the students in this classroom are students with IEPs or all students with disabilities. The teacher is a special education teacher. And so it is considered self-contained in that all the students are students with disabilities. But it's within a school that serves students with and without disabilities. The special class in a non-specialized school, we generally see it recommended for students who need that additional both academic and behavioral or social emotional support than is offered in the other non-specialized classrooms. Okay, now we're getting into more restrictive programs, and these are going to be programs that are located in different types of schools. So we'll start with special class in specialized schools or District 75. The non-specialized schools are called District 1 through 32 schools because there are 32 school districts, geographic school districts across the city. District 75 is not a specific location. It's not based on where you live. It refers to the special education schools that are located throughout New York City. So there are District 75 schools in every borough, and so there should be within every school district as well. These schools all serve students or only serve students with disabilities. So all the students who attend District 75 programs are students with IEPs. These are generally the classrooms that they have available, include 12-1-1, 8-1-1, 6-1-1, 12-1-4. Each of these different classrooms generally serves a student with a different profile. So, as like quick example, it's a 12-1-4, 12 students, 1 special education teacher, and 4 teaching assistants or aides. We generally see that program recommended for students who have multiple disabilities and who may also have limited language, academic, and independent functioning. And so they do need a high level of adult supervision and support. Generally, these programs are located in accessible schools or in accessible school buildings, I should say, that supports use of a wheelchair and other mobility devices. The 611 classroom, we generally see recommended for children who have autism, although it's not exclusively for children who have autism, but severe autism with really significant needs for academic support, social emotional support, language in particular, and sensory needs. The 1211, sometimes the difference between a 1211 and District 75 versus a non-specialized school is different it's challenging to see and to describe the profile. Generally, it's described as students who need that additional academic and social emotional support than what can be provided in a non-specialized school. But for many students, that may be a close call. So we do encourage you as a parent during this period in particular, if you can get to know more about the programs available, perhaps by visiting some non-specialized schools and also District 75 schools, being able to observe, see the classroom, see those students, talk to the teachers, that may be helpful in letting you understand which may be a better setting for your child. Then there are some schools that are called state-approved non-public schools. Non-public school is in the name. These are generally private schools that serve students with disabilities. So all children attending an NPS are students with IEPs. All the classrooms are special education classrooms. All the teachers should be special education teachers. Although it is a private school placement, the DOE will cover the cost of these settings if your child's IEP recommends an NPS. Unlike the District 75 schools and programs, NPS is not, and each individual NPS does not serve children with all different classifications. Usually an NPS will serve students with, will specialize in serving students with maybe 3 different classifications. So they may have expertise in specifically serving children who have autism and speech and language impairment, or there may be a school that has expertise and only accepts students who have the classification of emotional disability. They are more targeted in that respect. And so for many parents, they view that as a positive because it means that the school has a little bit more expertise in serving children with those particular needs. There is also residential placement that is available. This is really for children who require 24-hour care around the clock. We don't commonly see it referred for kindergarten students, but it is an option. And then there is home instruction that's generally recommended. It could be short-term or long-term. It could be for the full year for children who have medical needs that makes them unable to attend school safely. Okay. That was a lot to go over. So we're going to take a moment to check in, make sure you're awake and see if stuff is sinking in. If a child's preschool IEP recommends a special class, then the DOE must recommend a District 75 kindergarten placement. Is this true or false?
All right, Betty, we're seeing some trues, some false. But all right, the majority said false.
Great, and that is correct. And so I'm glad that most of you said false. There are no automatic recommendations, right? As Karen said, IEPs are individualized. It's for each student. And everything will be based on your child's current present levels of performance will indicate what type of program and services they may need for next year. So even if a child is attending a preschool special class for kindergarten, if they're attending a 12 to 1-to-1 preschool special class and doing exceedingly well, it could be that that child can do well in a 12 to 1-to-1 special class in a non-specialized school and doesn't need a District 75 placement. It may mean they're potentially ready to go into an integrated class in a non-specialized school. Or if the District 75 program wouldn't be appropriate, it could be that the child would need an NPS placement, right? If they have specific needs that District 75 can't address or can't meet, then perhaps the child needs a non-public school. So there are no automatic recommendations. This was just to make sure we can emphasize that for you. It's all specific to your child's needs and strengths. Okay, so we're going to talk about another set of programs that are available. These programs are offered in some, but not all DOE schools. And many of the programs on this list, in order to be considered for them, you have to proactively apply. So we'll start with bilingual ICT or special class. These are very similar to the ICT and special class programs that I described earlier in DOE non-specialized schools, with the difference that in these programs, children are learning both in English and in another language, right? And so for bilingual ICT and special class, you do not have to apply proactively. These are programs that at the IEP meeting, if it's determined that your child needs these language supports, then the DOE will recommend bilingual ICT or special class at the meeting. It doesn't matter if the school that's holding your child's IEP does not have a bilingual program. If bilingual ICT or special class would be appropriate for your child, the DOE should recommend that on your child's IEP. And then the Department of Education is responsible for identifying a school that can offer them that program. ASD Nest and ASD Horizon, these are programs that are specific for children who have autism. Parents do have to proactively apply to be considered. The ASD Nest program is a special type of integrated co-teaching class. It's a smaller ICT, and all the students with IEPs that participate in this ICT, in this integrated class, are children who have the classification of autism. This is generally considered a program for very high functioning students who are, at grade level or sometimes above grade level academically, and don't have any behavioral needs or many other deficits, really. It's really for very high functioning students. It is a very competitive program, and sometimes kindergarten is your best chance at getting in, we've noticed. There are ASD programs that continue for older grades, but generally families who are in the program, those students stay. We don't see that many choose to leave, and so kindergarten is kind of the main entry point to get into Nest. There's also the Horizon program. Horizon is a special type of special class where all the students in that special class are students who have the classification of autism. They're all diagnosed with autism. It's a smaller special class. It's generally 8 students. Compared to Nest, these students may need a bit more academic and behavioral support. One of the things that many families like about the program is that they do use ABA within the classroom, and not all of the DOE special classes do. And so families generally who are looking for ABA may be interested in the Horizon program. It's the same application. We are going to have a link to where you can find the application to all of these specialized programs that require an application later on in the presentation. AIMS is also a program for children who have autism, but it's children who have much more significant needs. So whereas ASD Nest is for very high functioning students, the AIMS programs for children with autism who need really intensive supports. It is a program that's available. It started in some, but not all, District 75 schools. Now there are also some AIMS programs located in non-specialized schools as well. But within the AIMS program, it's a 6-to-1-to-1 classroom ratio, where there are 6 children in the classroom, a special education teacher, a teaching assistant. There's also a speech therapist who's assigned to the classroom, who can really provide a lot of intensive speech therapy to the students every day. And so AIMS families should proactively apply if you're interested in that program. There is the ACES program, which is a small special class, generally for children with a classification of intellectual disability or multiple disabilities. This is a program that families need to proactively apply to be considered. There is the iRead program. This is a program that really focuses on early literacy. It's meant to be a program for children with IEP whose disability is interfering or impeding their ability to learn to read. Which may be difficult to assess at such a young age. So really encourage you to discuss whether this program would be appropriate with your child's preschool teacher. In iRead, it is a special type of integrated co-teaching class. So it is for students with and without IEPs. This is still kind of a relatively small program, so it's not located in too many schools. But if you're interested, you should apply. The PATH program is a program that is designed to serve students with behavioral challenges and social and emotional needs. It is a special type of integrated co-teaching classroom, so it is also located in DOE non-specialized schools, but not many. One of the benefits, so in addition to serving students with and without IEPs, and having a special education teacher available, as well as a general education teacher in the PATH program, there's a designated social worker to provide support. And there's also a designated occupational therapist who can support with sensory needs and other needs. Then we've added barrier-free and accessible. This isn't really a specialized program, so we're cheating a little bit in having it on this list, but we've included it here really to be able to let you know that not all DOE schools, not all the buildings are fully accessible. So they may not be able to accommodate your child's mobility needs, vision needs, or hearing needs. When you're applying to schools through the DOE's kindergarten application process, you are able to search for schools that are fully or partially accessible, and we recommend that you proactively apply to those schools. If you don't get an offer to one of those schools or your child needs a specialized setting, the DOE is required to make sure that the school that they offer you can meet your child's accessibility needs, and you should raise that at the IEP meeting so that everyone is aware of exactly what those needs are. And so that they know, for example, it needs to be everything on one floor, or the school needs to have an elevator and other things to keep in mind. Okay. I know that was a lot, so we're going to pause for a Q&A.
Yeah, we have two questions, Betty. I sent them to you. I can read them, but if you want to look at them, I sent them. So one person said, before the IEP meeting, is any representative from the DOE able to visit in person to evaluate the child? When can I expect the IEP meeting?
So part of this is what Karen covered in terms of like the DOE's role this year. In kind of the next couple of months, you should be receiving a letter from the Department of Education with your district or DOE representative's information. The DOE representative is a person who's going to be responsible for scheduling your child's IEP meeting, for scheduling any necessary evaluations that are needed beforehand, and is really going to be your main point of contact throughout this process. So first you'll receive a letter from them kind of introducing themselves. It's a notice of referral, letting you know that the DOE is preparing for your child's transition to kindergarten. After that, they should contact you and let you know, after they've reviewed different records, if they believe any evaluations will be necessary. If your child just received preschool evaluations in the past year, in order to be eligible for preschool special education, the DOE may be able to rely on those evaluations instead of conducting all new evaluations. That said, if the DOE is saying they don't need to conduct any evaluations, but you would like them to, you should write your DOE representative and let them know specifically which evaluations you would like them to conduct. Even though there may not be formal evaluations, there generally is at the very least an updated social history, which is kind of when the DOE interviews you to get more information about your child and progress they've made, or just an overview of when you first suspected they had a disability or something similar. And then there typically is at least a classroom observation where someone from your DOE representative or someone from that team will go and observe your child in their current classroom. So those are typically done. If the district representative is saying for whatever reason that they're not planning on doing it, you can proactively ask for that to be done before the IEP meeting. We're going to get in a moment we're going to go over all of the mailing you should receive, and that helps explain the timeline a little bit. But just so you know, preschool programs generally are required to submit progress reports to the DOE by like February 1st. And so typically IEP meetings do not start before then. because the IEP teams, should be able to, or shouldn't be having the IEP meeting until they have all the information necessary. So typically IEP meetings start sometime around, mid-February and will last throughout potentially the rest of the year, or the rest of the school year until every child has an IEP. Is there another question, Karen, that you would like me to answer now, or you?
Someone asked, does this process also apply to charter schools or private schools or only DOE schools?
So the process for creating the IEP is a process that applies to all schools, in that the DOE is the only agency that can develop the IEP for your child. It doesn't mean that your child has to go to a DOE school. The DOE will create an IEP if you choose to send your child to charter school. The charter school has an obligation to serve students with disabilities and to provide them with the services on their IEP as well. If they are not able to provide your child with the classroom that they need or the supports that they require, the charter school can't turn your child away, but they should be having that conversation with you and letting you know, for example, we don't offer a 6-to-1-to-1 special classroom, or a District 75 type of setting, right? So that you can think through, are there any accommodations that the school can provide to meet your child's needs? The DOE is still required to provide you with a program or a school placement that can implement your child's IEP, right? That can provide all the programs and services on the IEP. You do not have to accept it. You can choose to place your child in a charter school, or you can choose to place your child in a private school. As we discussed, there are different types of private schools. And so if you're talking about an NPS, a non-public school, this is the process to get your child into an NPS. If you're talking about a parochial school that you would like to place your child in, and then have the DOE provide special education services for your child at that school, you should still go through this process to get an IEP. If you decide you want your child to attend the private school, then by June 1st, you need to ask the DOE to change your IEP into an IESP, which is an individualized education services plan, which means that the DOE will identify what services they're going to provide your child in the private school, which may mean sending a speech therapist to work with your child at the private school. It may mean sending a special education teacher support services, a SETS provider, to work with your child in that private school. That has a June 1st deadline. That's very important. So we'll just flag that. If you mean a private school that's a special education private school, you still need your child should still have an IEP. They should still be identified as student with disability. That is kind of one of the requirements to be able to get into those private schools. And for the most part, those private schools will want to review the IEP to see if they can meet your child's needs. So yes, this is generally a process for all families of students with disabilities. You do not have to participate. If you no longer want your child to have an IEP, you can turn down the IEP. You can say, I don't want my child evaluated or considered. You can opt out at any time. So I hope that answers your question. I know it, there was a lot to it. So if it hasn't, if you need any clarification, please put it in the Q&A. But for now, I'll continue with the presentation just to be mindful of time. Okay, so we went over programs. Those are generally the classrooms that are available. Now we're going to go into different supports and services that are available. And these are available in any school setting. So in specialized schools, in non-specialized schools, across all of the classrooms, children who need these services can receive them or should receive them no matter where they're placed. You should be, or you may be familiar with all of these because they're similar to what is offered for preschool. So I'll just really focus on the ones that may be new. So one of that is special education teacher support services, or SETS. This is a special education teacher that can work with your child either one-on-one or in a small group for part of the day or on just a couple of days of the week to help reinforce some of the lessons that they're learning in their classroom. It's very similar to what See It is for preschool students. Specialized transportation in preschool students with IEPs who recommend a special class or a special class in an integrated setting automatically get specialized transportation to that program. That is not the case for kindergarten. Specialized transportation is not automatically recommended. It is only recommended if it's necessary for your child to safely get to school. And so it is something that should be discussed at the IEP meeting and added to the IEP if your child needs those supports. Specialized transportation generally means door to door, so picked up from the closest curb to your house and taken directly to the school. If your child needs, on top of specialized transportation, any type of accommodations, like a bus with fewer number of students, if they need limited travel time, so a bus route that's no longer than 60 minutes or another time period, that should also be discussed at the IEP meeting. For many of those accommodations, you would have to submit medical documentation before the meeting. And so you should start talking to your district representative as soon as you get their contact information about that, so that you can have all of the medical paperwork submitted beforehand, so that at the IEP meeting, it can be added straight in, and you don't have to wait to then submit those documents, have them reviewed, and have a reconvened meeting to discuss it. Behavior intervention plan is something that we don't see as much in preschool, but it's for children who are experiencing behavioral challenges or impacting their ability to learn. The Department of Education can conduct or should conduct a special type of evaluation called a functional behavioral assessment, or an FBA, where they observe your child throughout multiple days at different times of the day to observe what, the specific behaviors that are raised as challenging. For example, if your child is tantruming and like banging the table specifically, someone will observe them throughout the day for different parts of the day, or throughout various days during different parts of the day, to see when that behavior is taking place, what's happening right before, what's happening after, to determine is there the purpose or like what's the rationale behind this behavior, to see if they're able to identify, for example, every time you're banging on the table, it's when, the teacher is saying we're going into circle time for reading. So is this behavior because they're trying to avoid going into reading? Are they uncomfortable reading? Are they not feeling proficient in it? Is it the transition, changing from one activity to the other, that's triggering the behavior? And then develop a plan with you. There would be a whole meeting to develop this plan to see what the school can do to help address it, right? So what can they do to prevent the behavior, minimize the behavior, and steps they can take so it's not reinforcing, right? So if banging on the table gets the child to leave the classroom for a 5-minute walk, then they're learning like, oh, this is how I avoid circle time, as opposed to having other systems in place to really address the underlying cause of the behavior. So yeah, assistive technology also I think is more common for kindergarten than for preschool. It's a device, or it doesn't have to be high tech, it can be low tech, but some type of device or system that helps your child with learning or with communication. We do most commonly see it for communication, and see that it can be, for example, a tablet that your child is able to select images to help them communicate when they want or need something. So again, these are all available across all settings. I haven't gone into occupational therapy, physical therapy, and speech therapy because they are so common in preschool. Similarly, paraprofessionals, counseling, those many of you are familiar with. I will note for nursing, many children who get one-to-one nursing in preschool, generally that may be because preschool settings don't typically have a nurse in-house, whereas for most school age programs, they do, right? Most non-specialized schools, District 75 schools, they have a nurse on site. So if your child needs that one-to-one attention, you may have to submit, or you should submit new paperwork before the IEP meeting that makes it very clear that your child continues to need that one-to-one attention, even if there's a nurse already, on site. It is important to have all of that documented beforehand. Okay, And so, as I mentioned, I'm going to go over some of the mailings you should receive. And this gives you an overview of the timeline too, and kind of what to expect this year. So you should have already received a welcome packet from the DOE this fall that comes on yellow paper. It included information about the DOE's kindergarten orientation meetings. It includes information about the application process. And it's basically saying, hi, we're the DOE. We know your child is scheduled to go to kindergarten next year, and we're going to prepare for their transition. Then there is a notice of referral. This is a really key letter. This is a letter that tells you specifically who your DOE representative will be, who's in charge of your child's transition to kindergarten, will be leading the IEP team, will be contacting you about evaluations, will be scheduling that IEP meeting, will be coordinating with your child's preschool program to get all of their records, right? So this is a key letter. Most families will start receiving it in January or later. Some of these timelines change. If your child is not currently a child who has a preschool IEP, then this process will start later on for you, because first your child needs to be identified as a preschooler with a disability. There is a pink notice of case reassignment. This is only if your case is reassigned, meaning that the DOE representative has to be changed. The most common scenario we've seen this happen is if your child was assigned to an IEP team in one area, but then your zone school has the capacity to do more IEP meetings or help with more transitions. The zone school may request from the DOE the opportunity to take over your child's case because it's so likely for children to go to their zone school for kindergarten. Prior written notice and IEP, you should get these documents after the IEP meeting. They come on white paper, no special type of paper. The prior written notice summarizes what was discussed at the IEP meeting or the recommendations made, and includes a list of the documents that were relied on to hold the IEP meeting. The IEP should be the very detailed document with your child's present levels of performance, with their annual goals, with the programs and the services recommended. Families should also get a school location letter that's on green paper, postmarked by June 15th. This is a letter similar to the prior written notice in that it summarizes the IEP recommendation. But what's different from the prior written notice is that this green letter specifically lists the school that will be providing your child the program and services that they need for kindergarten. If you apply to kindergarten through the kindergarten application process, you will receive an offer. If your child's IEP recommends any program, any of those programs that I discussed for non-specialized schools, so general education, integrated co-teaching, or a special class in a non-specialized school, the letter listed on this green school location letter should be the same one that made you an offer through the application process. If your child's IEP recommends a District 75 program or NPS, then this green school location letter won't be the same as the letter, or won't list the same school as the one that made you an offer, but will list a District 75 school that should be able to support your child's needs, or that NPS. For families who apply to the specialized programs, you will also get a specialized program acceptance letter if your child is accepted, and this comes on like this purple lavender paper, and you may receive it after you get the school location letter. If you decide that you no longer want that specialized program, you can then reject it, choose to go to the school offered in the school location letter. Okay. Okay. Just because this is such an important document, wanted to show you a little bit of the difference between the prior written notice and the school location letter. As I said, both of them give an overview. What's the program that was recommended for your child? I realize I haven't discussed 12-month program versus 12-month. Children are eligible for school year-round. So for a 12-month program recommendation, if they would substantially regress if they didn't receive services over the summer. That's the same standard for preschool, and it is something that should be discussed at the IEP meeting. The prior written notice and the green school location letter will specify if your child has a 10-month or a 12-month IEP and what those services are for the 10-month program and also for the summer or extended school year, it's called as well. So the key difference though between the prior written notice and The school location letter, that's also called a prior written notice, is that the one on green paper will include the information for the specific school that the DOE is offering that can implement your child's IEP. We recommend that you contact that school. As you can see, the letter provides contact information. Call them just to make sure, I've got this letter. It's saying that next year my child is going to your school, that you have an ICT class. Is that right? Are you ready to have an ICT class next year? Especially the green school location letter or your child's IEP recommends a 12 to 1-to-1 special class in a non-specialized school, we recommend that you contact the school because unfortunately, although all schools are required to have that special class, in practice, they don't always. So call the school, see if they are able to provide your child with that special class next year. If they say no, you can either work with the school to try to get those services in place or contact the DOE to request another school option. If you haven't gotten any of these mailings, right, I just went over kind of a list of things that you will receive. If you haven't gotten the welcome packet yet or other notifications from the DOE, recommend that you reach out to them to make sure they have the right contact info. You don't want to be left out of the loop. You don't want to miss these important mailings. So one thing you can do is you can contact your CPSC administrator or one of the support inboxes. It's on the DOE website. This is a link to where you can find that information. Once your case is assigned a DOE representative, they should send you a letter. They should also call you. So if somebody's calling you saying I'm your representative and you haven't gotten anything in the mail, you should let them know and check with them to make sure they have your right address, telephone number, and email. You can get documents sent by email if you consent to it. You would have to give your email address and sometimes sign paperwork telling the DOE you agree to electronic notifications. And if you do that, then the DOE should be able to also email you an IEP, for example, or evaluation results and things like that. Families have the right to translation and interpretation. That means you have a right to documents in your language and also attending meetings where people speak your language. The most common languages that the DOE provides translation and interpretation for are Arabic, Bengali, Chinese, French, Haitian Creole, Korean, Russian, Spanish, and Urdu, but that's not limited. The DOE can and should provide interpretation and translation to your language no matter what it is. And for the most part, they do have resources available to provide translation and interpretation in over 200 languages. When we say translation, we refer to written documents, but that includes all the special education documents that we're discussing today. So the IEP, the prior written notice, all of those documents. And interpretation is for meetings, for conversations, it's spoken word. You have the right to interpretation, not just at that IEP meeting, but in any kind of spoken correspondence with the Department of Education. So if your DOE representative does not speak your language, they should be calling you with an interpreter or with somebody who can either through Language Line, which is like a phone interpretation service, or with a colleague or someone else who can interpret for you. They should not require you to provide an interpreter or should not tell you that you need to seek translation on your own. To request translation and interpretation, you can start by talking to your child's school. You can also request these from your DOE representative. If they're not providing or giving you support or information or not providing translation and interpretation, you can also use these request forms that are linked here. We will send you the slides with the link or by calling 311. Okay. I'll pause again for questions now.
All right, Betty, we got one that said, if I requested a paraprofessional at the IEP meeting, will my child get one?
So nothing is automatic. The DOE is not required to provide you with a program or service just because you request one. But if a paraprofessional is appropriate for your child and you can show that, then the DOE should recommend a one-to-one para. Some ways that you would show that would be appropriate. It depends on what the paraprofessional is for and why you're saying your child needs one. There are health paraprofessionals to monitor a child's medical needs or potential If they have a medical condition that needs close monitoring, then you would want to provide medical documentation about your child's needs and what the paraprofessional is required to do, and your doctor can assist you with that. If it's a crisis management paraprofessional for emotional support or because your child has behavioral challenges, then that's something you may want to talk to your child's preschool teacher. Can they submit a letter, something in writing, documenting your child's needs and why a paraprofessional would help support your child. If you have any private evaluations that you've had done that recommend a paraprofessional, you should consider sharing those with the Department of Education in support of your request for a paraprofessional. Those are all just different types of strategies that can help. It's really about showing the DOE this service is appropriate for my child. As we said, it's about a free, appropriate public education. So showing the DOE this is what's appropriate for my child, and yeah, helping you make that argument.
All right, thank you, Betty.
Thank you. Okay, then we'll keep going. As Karen said, we have a whole different webinar that's about applying to kindergarten. But in case you can't join that webinar, want to at least make sure you know about these key dates. The DOE's kindergarten application will go live in about a week. Applications are open from December 10th, 2024 through January 24th, 2025. This is your chance to apply to DOE non-specialized schools. There are 3 ways to apply. You can apply online at myschools.nyc by calling the DOE at 718-935-2009. They're open Monday through Friday, 8 to 6. Or you can go in person and complete the application at a family welcome center. Like I said, with translation and interpretation, it should be in your language. My schools, you can translate it to 10 languages, including English. And either by phone or at a family welcome center, the DOE has resources to provide translation and interpretation in over 200 languages. So you should be able to apply in your language. As you can see, the deadline to apply is January 24th. This is before the DOE, for the most part, before the DOE starts holding IEP meetings. So you do apply to kindergarten before the DOE holds your child's preschool IEP meeting and develops their kindergarten IEP. So you are applying to all of the non-specialized schools, not knowing yet what will be recommended for your child. But again, according to the DOE, they offer the same supports and services across all of their elementary schools. So all the schools have the general education program, integrated co-teaching, and special classes. Yeah. So let's check in, make sure you're still with us. You should apply to schools after the DOE holds your child's kindergarten IEP meeting. Is this true or false?
All right, we were split for a while, but now we're leaning towards false.
Okay, I am glad because I just went over this. You should not wait to apply to DOE schools until after your child's IEP meeting. Your child's kindergarten IEP meeting most likely will not be until after February, right? The DOE the schools are required to review, or IEP teams are required to review progress reports, hold evaluations, and all of that before an IEP meeting. And generally, the first date that they're able to do that is like around February 1st or later. That's after the DOE's kindergarten application has closed. So you need to apply to kindergarten now, even though you do not know what your child's kindergarten IEP will recommend. The reason, I know this may seem really out of order, but your child's IEP, or whether your child has a disability or not, whether your child has an IEP or not, is not a factor in whether they will receive an offer to these non-specialized schools. And according to the DOE, all of these schools offer the same programs and supports and are all able to meet students with those who need a non-specialized school. So you can apply now to express your preference. You can apply to an unlimited number of schools. You can choose to apply to just 2. You can choose to apply to 20. But the time to apply is by January 24th. Then the DOE will hold your child's IEP meeting. If your IEP recommends a program that that school that made you an offer cannot support, for example, if the IEP recommends a District 75 program, then the DOE will have to offer you a District 75 school, and you will receive that school's information in the green school location letter that I showed you a few slides ago. Okay. I hope that cleared things up. Again, talking about that school location letter, this is why it's important for you to check to make sure that the school that's written on the school location letter can provide your child with the IEP program and services that are recommended, right? You've applied to kindergarten, not knowing what your child's IEP recommends. You may accept an offer, still not knowing what your child's preschool IEP recommends. But once you get that school location letter, it means you've had an IEP meeting, you know the programs and services, and this is the school that's supposed to be able to provide those for your child. So call that school, make sure that's true. And many schools will allow you to visit beforehand as well. So recommend that you contact them right away. As I said, especially we see this come up with families whose students' IEPs recommend a special class in a non-specialized school. So a 12 to 1-to-1 in a non-specialized school. So the school that made you an offer through the kindergarten application process. If that's a school written on the school location letter, call them, make sure that they can have that type of classroom. If they say no, are there accommodations that the school can provide to be able to serve your child, you know, like an ICT with some additional supports throughout the day. Or you can request that the DOE provide you another school placement that actually has a 12 to 1-to-1 classroom. And for some students, if the IEP recommends a special class and the DOE doesn't provide it to you on time, or the school that they said will have that special class does not, you may be eligible for something called a Nickerson letter, which is like a voucher that you can use for your child to attend a state-approved non-public school or an NPS for a year. And generally, if your child can attend for at least a year, if that's determined to be the good fit and you and the school discuss it, it may be possible to keep your child at that school for future years based on the new IEP recommendation that'll be made before your child goes to the first grade. To get that Nickerson letter, we recommend you contact us so we can talk you through it, see if your child could qualify, and then we can help you in the process of requesting that Nickerson letter from the DOE. Okay, so if you run into challenges throughout this process, these are some of the resources that should be available to help you. So one is a DOE representative. As I said, this is going to be your main point of contact throughout this transition. And so you should reach out to them first with any question or concern. If they're not responsive to your question, if it's about special education specifically, you can reach out to the Department of Education Special Education Office. It's now also called DIAL, D-I-A-L. You can reach them at kindergarten IEP process at schools.nyc.gov. Feel free to copy Advocates for Children or a kindergarten account so that we can monitor your concerns and the DOE's response. You can also call the special education office. They have a hotline at 718-935-2007. If your question is more about enrollment or the application process, you should contact the DOE Office of Student Enrollment at ES, which stands for elementary school, ES enrollment at schools.nyc.gov, or calling them at 718-935-2009. If this doesn't resolve the issue, there are more formal processes in place for families, including requesting mediation, filing an impartial hearing, or filing a formal complaint. Mediation is a process where both you and the Department of Education would have to agree to meet to discuss the challenge. There would be a third party present who's a mediator to help support in those conversations to see if together you can come to an agreement. An impartial hearing is a process where you're basically suing the Department of Education. You don't need a lawyer, but it can result in something like in a hearing, which is something similar to a trial, where both parties bring in witnesses, and then the hearing officer, who's like a judge, will decide whether or not to award services or change a child's IEP, for example. Because it is like a trial, we do recommend you consult an attorney or seek some guidance if you can, but an attorney is not required. And a formal complaint you can file with the state expressing your concern with your child's IEP or special education supports. So going to end with some resources. These are resources on this page specific to special education. We have a transition guide. So for students with disabilities who are transitioning from preschool to kindergarten, it is like in a Q&A format. It's pretty comprehensive. It covers everything that we discussed today and then some. So would view this really as kind of the key resource that I would recommend if you have questions about the IEP process. The DOE also has a guide. It's available on their kindergarten and special education website. This is a link to the District 75 website where you can get a directory of District 75 schools, some more information about the programs, more information about what's the difference between an 8 to 1 to 1 and a 6 to 1 to 1 class, like what are the profile of students that they serve. And this is the link to specialized programs where you can learn more about NEST, Horizon, AIMS, iRead, all of those programs that I covered, and also where you can get copies of the applications if you're interested in submitting one. Those applications are usually reviewed on a rolling basis, so it is good to submit them early. And if for many of them, it may require the team to evaluate your child, and so they can do that while the DOE is doing your child's kindergarten evaluations, if any, to determine if your child would be a good fit for those programs. So there is a benefit to applying to those specialized programs early, so that eligibility could be determined while the DOE is creating your child's IEP. As I had mentioned, their DOE also holds kindergarten orientation meetings, so they are holding webinars similar to this. These are the dates for their upcoming sessions. As you can see, there's one on December 5th, specifically in Spanish, and then on the next one in English will be January 23rd. In addition to signing up for these live webinars, you can view the DOE's pre-recorded webinars on their website. For questions about the kindergarten application, we have a guide on applying to kindergarten that you can review on our website. The DOE also has a series of resources, including My Schools at NYC. You can find school directories there. You can also apply to kindergarten through this website. There are schoolsearch.schools.nyc. So you can find schools in your area. You can also through My Schools, but it'll give you your zone schools in your district. And by clicking on specific schools on either of these directories, you will be able to get a lot more information about that specific school, including different types of reports and information about accessibility, nearby transportation, specific contact information for school staff. The DOE has a kindergarten website with a lot of useful information, including the public school admissions guide that helps explain admissions priorities and just the process for applying generally across all grades. Okay, that is it. Please, I know that was a lot that we covered. We're about to launch a survey now so that you can let us know how we did. But we have this slide here because I know we presented a lot of information and it's a lot to take in. So please do not hesitate to call us if you have questions. We have a helpline available Monday through Thursday from 10 to 4 p.m. If you don't get through to someone, leave a voicemail and we aim at calling families back within a couple of days. The number is 866-427-6033. We also have an email address, so you can contact us to, if you have a specific question, and we'll try to answer your question there as well. Karen is generally, I believe, the person who responds to those, so you are in good hands. And so thank you for your time. Just a reminder, you are experts in your children. You have been through this process before, so you are well prepared to advocate for your child at their kindergarten IEP meeting and obviously beyond. So thank you for joining us today. Hope we answered your questions. While families are completing this survey, I'll also stay on for a little bit more to see if there are more questions in the Q&A. Okay, I'm seeing a couple of questions in the Q&A. I believe Karen hasn't covered them, so I'll just read them. Is charter school covered through the DOE? Charter schools are not Department of Education schools. They are public schools. They are free public schools, but they're run by a board of directors or a board of trustees and not by the Department of Education. That said, they do have to collaborate with each other. If your child has an IEP, the charter school is responsible for serving children with disabilities and providing the services on your child's IEP. And usually they work with the Department of Education to do that. So the Department of Education may have to send providers to the charter schools if necessary to make sure your child gets those IEP services. For example, if they don't have speech therapy anymore and they can't hire a new provider, right? That doesn't mean your child goes without the service. It's the responsibility of the DOE and the charter school to make sure your child is served. So they will collaborate in those ways. But if you are looking at information about applying to charter schools, that is a separate process from applying to DOE schools. And so we have a separate webinar on that you can attend. But yeah, so their charter schools are different from the DOE. It's separate, but for students with disabilities, you will still be working most likely both with the charter school and the DOE. It will be the DOE that will be developing your child's IEP every year and not the charter school. Okay, see another question. If they continue a 10-month program, they cannot go to a summer program that offers services. I don't.
Yeah, so this parent had asked if her child can receive services over the summer. So I had told her that if she would like to switch her child from a 10-month to a 12-month program, that she would have to request an IEP meeting to discuss, why the student may need a 12-month program. And so she had followed up and asked if they continue a 10-month program, they cannot go to a summer program that offers services. And so pretty much if the student is in a 10-month program and you would like them to stay in a 10-month program, that means that the DOE is not responsible for offering services during the summer.
Yeah, and when we talk about a 12-month program, the 12-month program for many students is the same as their 10-month program, especially if they're attending a special class. But it's not always, and it doesn't have to be. If the only area where a child will substantially regress, for example, would be in speech, and the only service that they need for the 12-month program is speech therapy, then it could be that that's all that's recommended for the extended school year is speech over the summer. Or, if a child attends a special class in a DOE non-specialized school, most of those classes are only 10-month, right? Most of those schools are only open for the 10-month. But if your child needs year-round services, it doesn't mean your child has to be taken out of that school for the full year and placed in another school that offers a 12-month program. It means that for that extended summer, right, for the extended school year, the Department of Education has to find a special class setting for those 2 months. So I hope that helps resolve, I hope that helps answer your questions. Let us know if you, okay, I see that you said, thank you.
Yeah, so those were all of the answers. I want to thank you all for being here for the presentation. I am going to stop the recording now because I do see a hand raised, and so I just want to make this a more private conversation. But thank you everyone who joined the call.